Hi, this is Team C5, and this is our project. The aim of this study is to minimize the risk and exposures of Maplewood residents to COVID 19 by creating an on site telehealth suite and implementing a standardized protocol for safe outside transfers. To date, there have been 260,593 confirmed cases of COVID and 60,491 deaths from COVID among residents of nursing homes. COVID exposures are directly associated with more frequent patient transfers. Luckily, 81% of patients in SNFs can be treated on-site rather than in hospitals. Telemedicine is a viable solution to decrease unnecessary COVID exposures. In the U.S., telehealth eliminates up to 387,000 transports to the ER per year, saving $327 million per year. Implementing Wi-Fi for telehealth would not only save Maplewood Manor time and money, but it would also address several social and psychological issues associated with restricted social contact. We performed an in-depth cost analysis of a long-term investment in telehealth versus continuing to transport patients to and from outpatient office visits.
Moving on to planned interventions, our overall study design follows the PDSA model. For our plan, we intend to create standardized protocols for the utilization of telehealth and transfers into and out of the Maplewood facility to improve patient safety and reduce COVID exposure for residents and staff. Our plan has 3 arms. 1. Enhanced telehealth capacity. 2. Standardized protocol for resident transfer out of the facility. And 3. A quarantine protocol for residents entering the facility. We intend to implement these new protocols as soon as possible, considering staffing capacity and cost. Over the next few months, we hope to have staff training on the new protocols, have established Wi-Fi within the building, and have appropriate documentation available to all staff members. There will also be an opportunity for staff members and residents to give input and voice concerns. Study. The outcomes we intend to measure include weekly positive COVID case numbers, percentage of transfers that are COVID positive, number of outside transfers to the ED or hospital, number of telehealth visits, overall cost and net savings, survey responses from hospital and staff. Act. After implementing our procedures and gathering data, we will reassess if our protocols have reduced patient utilization of outside care and reduced COVID positive cases as a result of transfer. We would address the concerns of staff members and reevaluate any methods that have not been effective thus far.
The first aspect of our plan, telemedicine, will be used as a triaging tool and convenient health service to minimize the cost of unnecessary hospital transfers, minimize COVID exposures, and reduce the risk associated with transporting physically or cognitively disabled patients. The implementation of telehealth at Maplewood Manor would be very straightforward. UPMC uses telemedicine software known as Video, which is compatible with most electronic devices. Maplewood Manor also already has tablets. The only need is Wi-Fi and locks for equipment security. Maplewood Manor will have a dedicated telemedicine room, which will be cleaned with bleach wipes between uses. We would also hire 3 nurse telemedicine facilitators for the 350-person building. A cost analysis is shown in Figure 2. We estimate an annual savings of over $200,000 per the first year. Generally, Wi-Fi access for residents can also address several mental and social health concerns associated with in-person visitation restrictions, including depression, delirium, and loneliness. Addressing these needs can mitigate the somaticized symptoms and improve patient holistic well-being. For patients who need immediate hospital care, the rest of our protocol addresses safe patient transfer.
New required documentation. To increase the quality of resident care both at Maplewood and at outside facilities, we will be adding a number of documents to our residents' files. The first, the summary of health, will be created by our in-house healthcare staff members, including the physician, OT, PT, and nursing staff. This document will detail our residents' active med list, active diagnoses, functional status, including an ADL checklist, a list of their current providers, and contact info for their POA or emergency contact person. The document only needs to be written once, but should be updated at the residents' monthly appointments. Second, it will now be required that all residents have a PULSed document on file. And finally, a triage document, which will be further explained in our protocols section, will need to be completed each time a resident leaves the facility for outside care.
Directing you now to Figure 3. There are 3 scenarios that would trigger our standardized transfer protocol: an essential outpatient visit that cannot be performed via telehealth, a concerning sign or symptom identified by a CNA or other staff member using the emergency warning system, or a positive COVID test. Residents who potentially require further care, such as at an off-site outpatient appointment or a visit to the ED, will be triaged by the MD, PA, or nurse practitioner on call to minimize unnecessary transfers or visits. If it is determined that a resident must be sent to the ED, a facility staff member will call and provide a scripted handoff to an ED physician. This handoff will include the patient's last COVID test status, the current COVID status of the building, and the resident's current vital signs and review of systems. Additionally, a triage document will be completed to accompany the resident that also includes this information. The resident's summary of health and pulse will also go with them to the ED. Similarly, residents attending an outpatient appointment will be sent with this documentation as well. For necessary off-site outpatient appointments, the facility staff will perform a similar triage and handoff protocol, and residents will be transferred by a designated staff member in a nursing home vehicle. Both staff and resident will be required to utilize face mask and eye protection for the entirety of the transport and visit. Residents will only be permitted to seek care in outpatient facilities that adhere to standardized PPE guidelines. Our policy will require that the transfer vehicle be appropriately cleaned between trips using a solution that is at least 70% alcohol, as dictated by CDC recommendations.
Hospital to Maplewood transfer policy, now directing you to Figure 4. All patients returning from hospitals should be placed in a new admission designated area, swabbed, and have a completed pulse form prior to returning to Maplewood. COVID-negative patients can be moved to the COVID-naive area if afebrile and asymptomatic after 14 days. COVID-positive patients will be categorized into symptomatic and asymptomatic, then further into immunocompromised and non-immunocompromised. Specific protocols will be followed for these patients as seen in the flowchart.
Discussion. We expect that utilizing telehealth and implementing these protocols will improve patient safety by reducing COVID exposures for faculty and staff and improving patient care by standardizing handoffs between patient care settings. It would be feasible to implement because it builds on protocols that are already being used by other care centers and CDC COVID guidelines. These protocols would involve interprofessional collaboration by physicians, nurses, and CNAs. The new documentation required, the summary of health and triage documents, would improve patient safety when residents go to the hospital or to another outside healthcare system. Utilizing telehealth would mitigate costs long-term as well. Wi-Fi access could improve patient quality of life by allowing patients to talk to their families and access the wider world under increased restrictions from COVID. The challenges to our plan include staff concerns. Some staff members may see these interventions as adding additional workload with limited staff. These interventions would also require training and more time. We also anticipate some objections to installing Wi-Fi because of the increased upfront costs. However, in the long term, it is more cost effective. To overcome these challenges, we would talk closely with staff and the administrators to overcome any obstacles or objections. Thank you so much for all of your time.